IPPF's vision is of a world where all people are free to make choices about their sexuality and well-being without discrimination. That vision is threatened by the climate crisis. The list of impacts of this intersection is devastatingly extensive. Limited access to services like contraception, safe abortion care, and STI testing and treatment. Reduced access to safe water during pregnancy and childbirth. Increased sexual and gender-based violence, and general neglect of the health and rights of people who typically face marginalization. Our humanitarian action responds to the needs of women and girls in emergencies all around the globe. In April 2020, Tropical Cyclone Harold, a Category 5 cyclone, made landfall in Vanuatu before passing through Fiji and Tonga. IPPF's local member associations responded, reaching a total of 4,698 beneficiaries across the 3 countries with sexual and reproductive health care. Kiribati, a tiny atoll in the middle of the Pacific Ocean, is extremely vulnerable to the effects of the climate crisis. Humanitarian youth clubs created by IPPF's member association design disaster plans for the community, focusing on women and marginalized groups in emergencies. In March 2019, Cyclone Ida hit Mozambique, resulting in widespread destruction of houses, hospitals, schools, roads, electricity, and water sources. IPPF's member association was quick to respond with life-saving sexual and reproductive health care through mobile outreach to the displacement camps. A total of 9,983 beneficiaries were reached by a team of 42 volunteers and staff members. IPPF is placing human rights, gender equality, and the rights of women, girls, and marginalized groups impacted by the climate crisis at the center of our efforts to address the climate crisis. We are calling on governments and other external stakeholders to do the same. Sexual and reproductive health and rights should be recognized as an essential element of climate change adaptation and resilience. Sexual and reproductive health and rights are critical for advancing gender equality, health, and well-being, and for overcoming marginalization. They are critical for strengthening individuals' and communities' resilience and capacity to adapt to the climate crisis. There is no doubt that the climate crisis is one of the key challenges of our time. Our planet is in a state of emergency. The time to act for women and girls is now.
talaga ng pagtaas ng mga. Kasi bakit ko lang talaga rin yung dito sa kapitalakan. Kasi wala po kami choice na dito nasa kabilang bahay. Buti ko po ako manunin na kasi naliwa ko hindi pa ako yung parang hero ko. Kasi kung sinasabi ko ako. Kaya ayun mo yung parang nakakatulog talaga. Kasi ang dami ko talaga yung umaalog na mga katawan ako.
Last year kasi, bandang November, nagkaroon kasi ng dengue, 3 anak ko. Sabay-sabay yun. Pagkatapos na isa lagdating yung isa. Ganun. Kumbaga, syempre isipin ko, tag-ulan na naman ulit. Ito na naman. Dengue na naman ang kalaban natin. Parang, kumbaga, hindi na natin maisip na, ano ba ito, meron pang pandemya, kuryente, tubig, tapos sabay pinagpipilitan pa yung schooling, tapos tag-ulan, dengue, kagaya niyan, kasi masyado mataas na sa kabilang dito, banda sa may kumbaga pag konting ulan lang talaga automatic ang tubig talaga dito sa amin ang punta. Isipin ko, baha na naman po.
Kahit sa gitna ng pandemya o sa gitna ng sakuna na nadulot or na-aggravate ng climate crisis, hindi dapat nagbe-breakdown ang sexual and reproductive health services among other basic health services para sa ating mga kababaihan at mga batang babae. Also, gusto rin nating i-reiterate or i-amplify na ang isang healthcare system or ang isang ospital na climate resilient ay mahalaga para sa isang sustainable or sustainable na SRHR for women and for all.
So, how does art matter when we are facing multiple global catastrophes such as the current COVID-19 epidemic, climate change, and the neglect of sexual and reproductive health and rights of women and girls? It turns out, and this has been proven time and again, that when art is meaningful and substantive, it can shed light on the problems we are confronted with, and this can lead to positive change. Art can educate, inspire, and empower viewers to effect change. Art can be a powerful reminder of those who suffer the gravest consequences of human events but have the least to say about it. Art that raises awareness of the state of the planet can be especially important in today's world. This is the kind of art that matters as we confront the devastating forces of coronavirus, climate change, and human cruelty, ignorance, and neglect. In the next few moments, let us look and listen to our artists as they wake us up to the opportunity that this pandemic offers to find ways to support the planet and each other in the difficult journey that we all have to make. Let us allow them to ease our burden, even for just a moment, and give us the energy to take the next step.
Hello, everyone. Thank you for joining us. We have a couple more people logging in, so we're going to give it a minute or two to get them settled and we'll get underway. Thank you so much for everyone who has already joined us. Just give me one more minute and then we'll get started. Okay, I think we are ready, so we'll get going. Thank you for joining us today for a webinar launched towards gender inclusive, climate resilient, and equitable sexual and reproductive health care. This webinar is being co-hosted by the International Planned Parenthood Federation, East, Southeast Asia and Oceania region, IPPF ESEAOR, and Healthcare Without Harm, Southeast Asia, as part of a strategic partnership that aims to promote gender-sensitive, climate-resilient, women's and girls' health agenda across Southeast Asia and the Pacific. My name is Natasha. I'm the Senior Officer for Advocacy and External Relations at IPPF ESEAOR and your moderator for this webinar. Before we get started, I would like to cover a few housekeeping topics. To preserve bandwidth and ensure that there are no disruptions, kindly mute your mics and turn off your videos when you're not speaking. Please note that today's webinar is being recorded and we will be sharing the link. We will be able to share the link with you after the event is complete. We are also invite your comments and questions. Please use the chat box in Zoom to share your comments, questions, and reflections. If you think of a question for a speaker at any point, please type it in there, and I will either pose it to our speaker at the end of the event during the Q&A session. And lastly, please stay with us until the end because we have a photo session. And we can now get into this webinar. I would like to hand the floor over to Tomoko Fukuda, the Regional Director of IPPF ESEAOR, to give her opening remarks. Tomoko, it's all yours. Thank you.
Thank you, Natasha, for that introduction, and welcome everyone to this webinar. When there are so many competing agendas and things that you need to be on, I really appreciate, and we all appreciate you taking time to be with us here today. The topic that we're talking today is extremely important for us. I think we are all so well aware of the vulnerabilities that we have in this region, especially in Southeast Asia and the Pacific, with climate change and environmental degradation affecting our lives so often. Just recently, we've seen the volcano erupt. We have floods on a regular basis in our countries, landslides, earthquakes, tsunamis. We have the full range of climate change impacting us in this region. We've all been wanting to address how women and girls have been severely affected by this. IPPF, as we work in sexual reproductive health and rights, we have long been talking about the need for us to be working on this. And we were looking to find the right venue. And I am very happy to share with you that today, this webinar, we are launching together with Healthcare Without Harm. We agreed to join a partnership towards the end of last year in the run-up to COP26 to say, look, we want to address this agenda, forward it together. Let's join a partnership and see how we can work together to address this. So towards the end of last year with this partnership, and we've also launched a project to see how we can concretely work with the communities and with our partners. We're very happy to have the Reproductive Health Association of Cambodia and the Solomon Islands Planned Parenthood Association are the IPPF member associations in Cambodia and Solomon Islands as a partner in this project. We are very excited to launch this project and see what is it that we can do together. As IPPF, we have been working in the humanitarian space for quite a long time now with the support of the Australian government. We've worked with Southeast Asian countries, we've worked with Pacific Island countries to deliver the very much needed sexual reproductive health and rights care during crisis settings. We know that not only is access affected, but we see rises in sexual and gender-based violence. We know that crises like this also serve to increase displacement of people, especially those who are in marginalized or underserved communities, to be in more harm when humanitarian crisis happens. So this is to see, and as the CSW is now going on in New York, what is it that we can come together to do together in the communities towards a gender inclusive, climate resilient, and equitable sexual and reproductive health care. Us as healthcare providers, us as community advocates, how can we exchange our knowledge, our tools, our communication, and bring our forces together? So thank you so much for joining us today. And I think it shows the heightened interest in this area of work. And we look forward to continue working with you on this throughout the year. Thank you to our partners who are working together on this. And through this next hour, look forward to discussing further. So that with that, I end my introduction and hand back to you, Natasha.
Thank you, Tomoko, for laying the ground for this important partnership and the urgent need to work in the area of climate resilience and SRHR, integrating sexual and reproductive health care into climate resiliency, into preparedness, response, and recovery. Thank you. We will now play a video monologue of the impacts of the climate crisis. So I'm going to hand it over to Pat, our tech guru, to play the video. Thank you.
Pounding on the walls, howling in the darkness, battering the life out of our little kubo. It wasn't anything that I have lived through nor imagined. And in between my feverish thoughts, I wrapped my child in the only blanket my searching hands was able to reach. And then I closed my eyes.
In the news, authorities said minors are not allowed to go out. The virus was spreading in every city, every barangay. It was fast, just like the water in the river. During the last typhoon 5 months ago, 3 feet, 5 feet, all of a sudden I was climbing up roofs with my siblings, running for our lives, while blood was trickling down my legs.
I remember that night. My mother wasn't able to get food packs from the local government. They said that there was not enough supply for everyone. But his cold, wet hands were all over my thighs. He said to never tell anyone or he wouldn't give us ayuda. I was young, vulnerable, and the storm was raging outside.
I am a mother.
I am a young student.
I am a trans woman, and I am affected by the climate crisis.
I hope everyone enjoyed watching that monologue and hearing from individuals who have been affected by the crisis, and hearing their stories, and especially the last part, which said no climate justice without gender justice, highlighting the importance of interlinkages and an intersectional approach and a rights-based approach to the work that we do. And that will segue really nicely to our next speaker, Athena Galao, who is an international consultant for gender and climate change with UN Women Regional Office for Asia and the Pacific. will be presenting an overview of the climate crisis and SRHR and building a gender responsive, inclusive SRHR and climate agenda. Over to you, Athena.
Hi, Natasha. Good morning, everyone. That was really that was super powerful, the video. Also because I'm Filipino, so those like the language and the stories and just a bit of a background from my side. For a very very long time, I worked in the humanitarian sector. So that monologue really struck me, and those are really the realities that you hear and the stories that you hear constantly in different humanitarian situations. I worked so much and even in Haiyan in conflict situations in the Philippines. So thank you for providing such a reminder of how, yes, intersecting in multiple forms of discrimination really affects and falls heavily on women and underrepresented sectors. So good morning. Wow, that was a great start, but good morning to everyone. Maybe Natasha, you can pull up the presentation and we can start from there. I'm given 10 minutes, so I'll try to be brief as much as I could. But just a segue. I know that I'll probably start with a very and Tomoko did start with a very bleak picture of what it's gonna look like, and what it has been looking like for a lot of people. The last IPCC report showed us that this is, at least this stage until 2030, is the last window of opportunity to really address climate actions. And we need transformative change anchored on gender and climate justice, and try to dismantle the roots of structural issues that puts us in this position. And there has been mounting evidence that it will have detrimental impacts, not just to humanity, but definitely to women and girls and people of diverse ages. So let me, I can't see the presentation though. Is it my view? Oh, there, there. Thanks, Natasha. So next slide, please. So maybe three things that I would like to highlight is, again, Tomoko has, and the last videos before my session show that climate change definitely threatens human rights, and it includes SRHR alongside the right to life with dignity and food and health and other interrelated rights. And women and underrepresented sectors often face the brunt, and these are the same sectors that have been historically marginalized and have already have limited access to SRHR services. So what it looks like so far in the humanitarian crisis that I've seen is that there is definitely a breakdown of health services, and because there's limited understanding of gendered needs, it also results to a disruption of SRHR services, including maternal health, contraception, family planning, and treatment and diagnosis of HIV. And even in the Philippines, it's really rampant that when there is an emergency, there is a breakdown also of referral systems and psychosocial services. So it's really problematic. But at the same time, Tomoko also underscored that there have been a significant increase in gender-based violence. We know for a fact that the last 2 years of the COVID pandemic has resulted into 245 million direct 245 million girls aged 15 and above, which have been subjected to gender-based violence. In the humanitarian crisis as well, you know that for a fact that there is limited funding. It's really difficult to fundraise to address like a massive amount of needs, and often than not, SRHR and GBV is sidelined. And then finally, climate impacts will have acute and also long-term repercussions. So one of them, of course, is water scarcity, which will have impacts on maternal health and reproductive health. Others are food insecurity, which will definitely have impacts on food insecurity, which we have now seen currently will have impacts on child marriage, and also sexual, what do you call, sorry, I'm so confused now because it's so intersecting. So food insecurity, which results to negative coping mechanisms, including child marriage and transactional sex and even trafficking. So these are like the big things in terms of SRHR. There are a lot of organizations trying to build evidence on how SRHR is affected by the climate crisis. So we're going to see more of that in the coming months, I hope. And then the second point I would like to make is that climate actions can definitely affect SRHR. Um, Now there is a clamor for gender responsive climate actions, and what it looks like is that there's heavy reliance or heavy recognition of the need for gendered analysis, which means that we are able to look into the gender specific needs of people, and which could be a good entry point for addressing SRHR issues as well. But there is, of course, still a dearth of data around how those are related to each other. But at least there are entry points that we are seeing in the climate space. Finally, we know for a fact that the realization of SRHR can contribute to building resilience and adaptive capacity while addressing simultaneously risks and inequalities. Bodily autonomy can definitely lead to empowerment and well-being, and these are the preconditions for full and meaningful participation in society. This can result into more informed decisions in managing risk, engagement in livelihood activities, and even contribute to more collective actions. So we see that there are like clear linkages on SRHR and climate action, and really have to expand and maximize and build on those entry points to really push for SRHR as an agenda. Next slide, please. So these is lifted from the last installment of the IPCC report. SRHR is not explicitly included, but if you look at the different impacts on human systems, you know for a fact that this will definitely have severe implications for SRHR. You can check out the full IPCC report, not here in the website, but you can find it on the website. There is still the next installment, which I hope would also provide clear approaches on how to really address all these issues. I would like to highlight that Asia, it's not looking good for Asia, and definitely not looking good for our Pacific island communities as well. Next slide. So what are our propositions and what we hope to do? I hope that we also contribute as UN Women, is that we take a rights-based approach into climate action, which centers on consent and individual reproductive choices and not on population control targets. Enough of those narratives where we use SRHR as a mitigation to climate change. We have to focus on marginalized and disadvantaged communities, thinking beyond women, of course, and really looking in towards eliminating sex and gender-based discriminations for people of underrepresented SOGI. And when we talk about human rights-based approach, we emphasize that the accountability of duty bearers to deliver and ensure full and comprehensive range of health, economic, and psychosocial services and information. So the responsibility definitely falls into duty bearers, but we are here as equal duty bearers to support them, to support governments. We also want to see more transformative norms and policies. We also want to transform norms and policies to integrate SRHR. In the last COP26, which some of you might have attended, there was really a staggering recognition that gender equality has been integrated into nationally determined contribution. And it's true, at least 50% of new NDCs have languages like relating to gender equality. But the last UNFPA assessment showed that only 6 of 50 NDCs that they reviewed included language related to SRHR. So it's really still problematic that SRHR is not explicitly included in NDCs and these policies. So there's really still a need to work on the policy side. Thank you. Thank you so much, Jit. The second one is that we always say that when we utilize HRBA lens and of course gender equality, we must guarantee and support women's girls, and diverse soldiers leadership and meaningful participation in resilience building. I don't think I need to emphasize this because this has been like we have been promoting it, advocating for this for a very long time. A third is that we have to ensure that there's adequate financing for SRHR and climate actions, humanitarian actions, and DRR activities. I think the last report from OECD showed that there is out of out of the climate related official development assistance, or ODA, only 0.04% of all those is going into gender specific actions. So I obviously SRH will fall into gender specific action. So it's really a bit problematic. And this is not just this, and we haven't dealt into like who actually has access to this ODA, and do women and girls and diverse OG have control over the use of this financing. So just having adequate sustained financing for SRHR is really important. And last thing that I want to emphasize is that we have to build evidence around the evidence on the linkages of SRHR and climate crisis. There is evidence that's out there, but it's not enough. We need to generate gender data, but also try to utilize other data collection methods to fill in gaps and provide a more accurate picture of realities on the ground. This could be in the form of including SOGISC and rapid gender assessments and vulnerability assessments using gender markers. And also on building evidence, we need to establish and try to establish, because when we have evidence, we can establish the linkages and break down silos and really consolidate promising practices and approaches to SRHR and climate resilience. So next slide, please. So these are some of the tools and publications. Some of you might have even attended the consultation in 2018. I hope some of you did, where we tried to look into how SOGIS is sidelined into humanitarian actions. And these has resulted into different tools and reports, which you can see here, The Only Way Up. And we also developed a training manual together with Arrow, which is anchored on SRHR in the whole climate resilience building work. And last December, we also launched an e-learning course, which you could find in UNCC Learn. So all information could also be you can also get from empower.org, our website. And then last is the resources is also included in the last slide of this. And again, thank you so much for your time, and looking forward to collaborate with all of you in advancing SRHR in climate action. Good morning.
Thank you, Athena, for that very comprehensive presentation in the time that we provided you to share. And thank you for highlighting the linkages between the climate crisis and SRHR and the impact on women, girls, and people of diverse OGSC. And I really like I liked all your slides, right? Like the one at the end where you mentioned the priority actions and the linkages between policy change and DRR and humanitarian, and the need for more evidence and backstopping that evidence within systems that are already existing rather than creating something new. We should just look at what we already have and see how we can build gaps or fill the gaps through that, whether it's through, like you said, the various mechanisms that are available, or it could be things like the Sustainable Development Goals, and looking at that and seeing how it can be more comprehensive in terms of data collection. So thank you so much, Athena, for your time, and please do stay with us for the rest of the session. And now we will move on to the next part of our webinar. And I invite Jit Sohal, the Regional Program Manager on Climate and Health with Healthcare Without Harm Southeast Asia, to share an overview of the pilot project, Advancing Health and Gender Equity by Building Climate Resilience and Sustainable Health Facilities and Communities in Cambodia and Solomon Islands. Take it away, Jit.
All right, can you guys see my screen? the presentation. All right. Thank you, Nat. Thank you, Tomoko. Thank you, Athena, and the women in the video for providing the basis on why this project is very important and very timely. So I am Jit Sohal, the Regional Program Manager for Climate and Health of Healthcare Without Harm Southeast Asia. Now I'm also the Project Manager from Healthcare Without Harm for this specific pilot engagement that we have with IPPF, RAC, CPA. So Healthcare Without Harm Southeast Asia is part of a global non-profit organization that seeks to transform healthcare worldwide so the sector reduces its environmental footprint and also become a leader in the global movement for environmental health and justice. In this project, we are supporting IPPF, the Reproductive Health Association of Cambodia, and the Solomon Island Planned Parenthood Association. So this is the title of the project, Advancing Health and Gender Equity by Building Climate Resilient and Sustainable Health Facilities and Communities in Cambodia and Solomon Islands. I'll be going through an overview, very quick overview of the project objectives, the main outcomes of the project, and our target beneficiaries and some of our activities. So the main project objective is to develop sustainability and also strengthen the resilience of health facilities and also member associations in Cambodia and Solomon Islands. Our overall goal is, with this project, we are able to contribute to reducing health and gender inequities and addressing climate justice. Specifically, the project has 4 objectives. And the first one is climate resilience and sustainability of healthcare facilities and member associations in Cambodia and Solomon Islands are strengthened. Women and girls in Cambodia and Solomon Islands are trained as strong advocates for climate and SRHR. Policies on healthcare climate resilience, SRHR, and gender are advocated by our champions. And lessons learned, best case studies, and other learnings from this pilot engagement are shared with other member associations of IPPF and our other partners in the region and beyond. So this webinar is actually one of the activities under the 4th objective. Target beneficiaries for each of the countries. For Cambodia, we have 5 health facilities. In Solomon Islands, we're targeting 3. When we say health facilities, we mean their member clinics. We also target to support and provide capacity building support to staff and volunteers of the member associations in both Cambodia and Solomon Islands. So within those project objectives, we have 6 specific project outcomes that we, in partnership with IPPF, RAC, and CIPA, would like to achieve. One is that target beneficiaries are aware of the issues of climate and health, as well as the intersections of climate and SRHR and gender equality. The target health facilities understand their level of vulnerability and their adaptive capacity to climate change and be able to develop plans so that they become more climate resilient. And the third one is that they are also able, as they become climate resilient, these health facilities also transition and move towards becoming more sustainable and low carbon by understanding and having a baseline assessment of where they are in their carbon footprint, and also developing a plan of action around it to reduce their emissions and decarbonize. So activities under these 3 outcomes are development of climate and SRHR communication and advocacy toolkit, and also awareness raising communication and communication tools and materials. We'll also do a series of virtual workshops on SRHR, gender equality, health equity, and climate justice. We will also orient them on several of our initiatives on global green and healthy hospitals, healthcare climate challenge, Race to Zero, our tool that we use to come up with a baseline assessment of carbon footprint, and also on conducting vulnerability and adaptation assessment. And the next three outcomes are full of empowered and capacitated health and climate champions, including women and youth, are identified and will advocate for gender and health equity and climate justice in the target countries. And that policies on health resilience and SRHR and gender and climate justice are also advocated at the local and national levels. And last but not the least, all these learnings and best case studies and stories are shared with the result and impact of this initial pilot engagement with other member associations and partners of health, IPPF ESEAOR, and Healthcare Without Harm in Southeast Asia. So that's basically an overview. I don't have much time to share with you the details of each, but we'll definitely give you an update at the end of the project again. Another webinar is also organized by the end of the project to share with you our learnings, the results of this pilot engagement, and hopefully we can replicate this in other parts of the region and we're working. Thank you so much, Nat.
Thank you, Jit. I'm just quickly, I'm just looking at I think some people may not have been able to see your presentation. So I just want to let everyone know that we will also share the presentation after the session, and we apologize for that technical difficulty. But thank you, Jit, for providing a clear summary of the pilot project. And now we will hear directly from the two organizations that will be implementing this project. And they are also IPPF ESEAOR's member associations in Cambodia and the Solomon Islands. I'm happy to invite Dr. Var Shivon, the Executive Director of Reproductive Health Association of Cambodia. Dr. Shivon, the space is yours. Thank you.
Thank you very much. Thank you, Natasha, and thank you, Healthcare Without Harm, Ramon and Jit, for your operations and assistance. And thank you, IPPF Regional Office team, Tomoko, Jason, and Natasha for helping and working together for these projects. And I don't have the slide. I just talk and read my note. And you may know that Cambodia is considered as one of the most disaster-prone country in Southeast Asia, and with ranking top 12 globally. And the vulnerability associated strongly with frequent floods and droughts on a seasonal basis. While the severe characteristic of gender stereotype, social stigma, discriminations, and as we all know, gender-based violence in the condition of least development and is still not fully addressed. And of course, women, girls, elder, minor groups such as LGBT people, people who live with diseases are the most vulnerable groups to climate change and disasters. And I would like to lay out some background information at the national level, and then I will go brief a bit on what RAC have been doing and plan to do. And we know in Cambodia that the government is strongly aware of the serious impacts of climate change in the country, as it is indicated in the Cambodia Rectangular Strategy. And this Cambodia Rectangular Strategy is known as the Prime Minister Rectangular Strategies, and now it come into phase 4 starting in 2018. And in that strategy, we see the government have put the effort to reduce the impact of climate change by strengthening adaptation capacity and resiliency to climate change, and particularly by laying out the implementation of the national policy on green growth and the national strategic plan on green growth 2013-2030. And the government also continues to strengthen the technical and institutional capacity to promote mainstreaming of climate change responses into policy, law, and plans at the national and the subnational level. And they continue to introduce measurement tools in order to control environment and the ecosystem pollution. In fact, based on the rectangular strategy, the sectoral ministry developed their strategic plan for implementation. For example, in the health sectors, there's a 5-year national strategic plan on disaster risk management for health, and the National Climate Change Action Plan for Public Health from 2019 to 2023. And these action plan are compulsory approaches in order to reduce the impact of climate change on health sectors. In that strategy, there are 4 prioritized programs and 22 sub-programs. And these include reproductive health, HWCH, immunization, and nutrition. And based on that commitment, now the government make a decision to modify the technical working group on health into a technical working group on climate change and health. And this technical working group is chaired by Secretary of State of the Ministry of Health. And the change in the new to cover the climate change is to cover the purpose, composition, duty, and mode of operation. And this change to cover the climate change is a mechanism to enable National Climate Change Action Plan for public health and continue to play vital roles in coordinating the implementations of the technical working group effectively. And despite of the intersectoral technical groups, the Ministry of Health also established coordinating group for emergency response and recovery that has representatives from all departments and programs of the Ministry of Health. And they are also a member of the health sector sub-working group of the National Committee for Disaster Management. And this is just lay out the background information for you. And although we have a policy, sectoral strategy plan, and action plan, which are ready for transferring into action, but the budget and resource for implementation are still limited and on the desk for discussion. And as Athena has mentioned in her presentation as well about the financings of the climate change and SRHR. And to support the government implementing the policy and sectoral strategic plan for that, we, as you know, we're not only working on SRHR now, but also to consider the cross-cutting issue, which are underlying causes of preventing people from accessing SRHR, such as climate change. In that, in 2021, RAC conducted an assessment of to understand about climate change impact on health of women and girls, especially sexual and reproductive health. And according to preliminary result, ANC, pregnancy care, institutional delivery, postnatal care, and abortion are the most demanding services, but the availability is still limited during the disaster. The most notable point is limit of understanding about healthcare during pregnancy lead them to not consider the basic needs of health service during the disaster. And this result will be the baseline data and information to advocate further for the process of implementing the strategic plan on disaster risk management for health. And beside the study, as JIT lay out and show the background information about the project. Implementation this project with the assistance from Healthcare Without Harm and IPPF and with the Solomon Islands. And this project is intended to develop sustainability in and strengthening in the climate resiliencies in selected healthcare facility in Cambodia, with overall goal of reducing health and gender inequity and addressing climate justice. We have, as JIT laid out, engaged in 5 health facilities, 45 RAT staff, and 120 volunteers. And with the past few months, Healthcare Without Harm, IPPF, we together conducted a virtual focus group discussions with RAT staff and health facility staff to understand the level of climate change and SRHR awareness among the staff, and also to exchange knowledge and resources on the intersections of climate and SRHR that is in early March. And this result of focus group discussion will be very significant to produce the climate and SRHR communication advocacy toolkit, I think in around mid-June. And also plan to, together with Healthcare Without Harm, we plan to implement and promote the global green and healthy hospital network, healthcare climate challenges race to zero, climate impact checkup tools with RAT team and target health facility, and also build up on SRHR, gender and health equity, climate justice, and healthcare resilience to RAT core team. We also plan to engage and support women's girl youth advocates, women champion in broadening the dialogue on SRHR needs and service in various platforms. Thank you very much.
Thank you, Dr. Siobhan, for sharing the current situation in Cambodia, your expectations of the project, and also the work that is already currently undergoing in Cambodia around building evidence to promote better sexual and reproductive health care during emergencies or impacted by the climate crisis. Thank you. And now we will call on Ben Angoa, the Executive Director of the Solomon Islands Planned Parenthood Association, who is also an implementing partner of this project. Ben, over to you.
Hello, hello.
Hi, Ben. We can hear you.
Good afternoon.
Good afternoon.
Good
Please
afternoon.
go ahead.
I have a bit of internet problem, so I'll try present my presentation quite quick. Yeah. So anyway, before I start, thank you very much, Natasha, the regional director, Tomoko, Jason, and our partner HWCH. Thank you for the opportunity. You might all know that Solomon Island is one of the country amongst the most vulnerable country that is always affected with climate change, just as tropical cyclones, drought, heavy rain, floods. Solomon Island has a very high exposure to other natural hazard and low coping capacity. Yeah, the country has a wealth of natural resources and unique geographical features. but its geographical location in the Pacific ring of fire and cyclone zone makes it very vulnerable to a natural disaster and other extreme events. So yeah, over the years, from experience, we've been, you know, we've been affected by several tsunami, earthquake and tsunami, and a few cyclones, and even flash flood. Yeah, so those are the events that I remember. We've been involved, and SEPA is being part of its humanitarian response, also respond in it. Yeah, so in terms of what action SEPA is taking in terms of preparation, response, and recovery, I want to take us back on the health status of Solomon Islands, especially how complex it is here, as the country is among those experiencing the so-called epidemiology transition with substantial impacts from both communicable disease, including malaria and tuberculosis and other non-communicable diseases, such as obesity, diabetics, and other circulatory disease. Yeah, so SEPA, with this project, it's like first of its kind. So we've been started working with, especially with the environmental office, the climate change office, and we really want to see how we can integrate SRH into climate change, and if the government has any plan, yeah, on integrating health into climate change. So these are the things that, because since we started this project, we started to walk out of the box and start to explore other things and all this, and I find it very, very interesting. There are lots of things that climate change cause that directly affecting SRH. Yeah. So in terms of what SEPA is expecting and its plan with the HWCH, we're planning to build effective and efficient resilience of health plan, and even the facilities. We want to work with the government clinics and hospitals, even empowering the staffs, and how we're gonna involve young people in this project. So currently, as part of our preparation, we've been doing some consultation with few champions, especially those in the Solomon Island Broadcasting Corporation, because we want to use them a lot to advocate. We even start to talk with the some political appointees in the government, and especially in the Prime Minister's office, on how they can support us. Yeah, and with our long partnership with the Ministry of Health, I've been discussing this with the PS, and she was really supportive of this project. So we were just waiting of when we started, but otherwise our groundwork is almost complete. So that's a bit from me, Natasha and everyone. Thank you so much.
Thank you, Ben, also for highlighting the situation and the context of Solomon Islands and how different it is from Cambodia and other countries. And it's really heartening to hear that there is ground support and also policy level support to implement this project. So we're really excited to get this project started in Solomon Islands. I'm going to take a pause here and ask if anyone has any questions at this point. We're also recognizing that we are a bit behind time. If there are any burning questions, please do raise your hand and we can call on you now. But if you do think of questions later, please do get in touch with us via email and we will connect you with the right people and or respond to you directly with your questions, with responses to your questions. Jit, I'm just going to look at you to see if there's anyone with your hands raised. No?
Or none, yeah.
Okay. All right, if there are none, then we will move to the next part of our webinar, which is the closing remarks. I will hand the virtual mic over to Ramon San Pascual, Executive Director of Healthcare Without Harm, Southeast Asia. Please take it away, Ramon.
Mon, you're muted.
Ceremony.
Okay. Am I heard now? Good morning once again. I've been listening from a coffee shop a bit far from home here in Manila. But I'm really happy to see this project taking off officially with this launch and seeing the responses and the reactions from people who are viewing and listening to this webinar. Tomoko, we're grateful that you welcome and embrace right away this partnership. Well, we will work on building resilience in facilities and communities where IPPF and its different networks, both in Cambodia and Solomon and hopefully in other places in the Southeast Asia, are present. And as well, listening to Athena and then the project presentations made by my colleague Jit, and then as well as the welcome from Dr. Siborn from Cambodia, and Ben, our partner in Solomon, as far as this project is concerned. Now we can say that we are looking forward. But in my own mind, to me, this is a fruition of many work being done already by SRHR communities, and one of the leading global organization is the IPPF, as well as the many climate and environmental activists that have been in the forefront of climate and health work over the years, and that is including the Healthcare Without Harm, and we are the Southeast Asia office. It is a partnership that has been waiting for many years, and the time has come, and we know that this will grow. The inequity and the injustice on one hand is taking place on how climate action and how climate crisis is interpreted, and how the climate action is delivered worldwide. We are the most affected, and yet the biggest developed countries are also the biggest emitters. But the injustice also taking place in the healthcare system itself, apart from the communities. It may not be known to everyone, but 70% of the workforce in hospitals in the healthcare sector are women. 80% of nurses all over the globe are women. And yet the leadership and the specialist role in this healthcare system is assumed by men. So when we talk about taking care of SRHR in the context of climate crisis, we are talking about two communities right away. On one hand, these are the community, the regular communities where we live, our own neighbors, and then the facilities surrounding them. But as well as the whole issue of gender inequity in the healthcare sector. We need to build resilience, as we build climate resilience. So we're not talking merely about facilities and hospitals and clinics. We're talking about people. As we address climate, we need to strengthen people who are at the forefront of building families, communities, societies. And this is where this project contributes in a small way, but we know we can grow it. So we are inspired, we are hopeful. We saw the video, it was really impactful, but we do hope that we will emerge out of this project from that situation of seeming hopelessness to really taking positive action for climate justice and women's equity as well. Thank you so much.
Thank you, Ramon, for your closing remarks and that resounding call for climate justice and gender justice, that we can't do one without the other, and how important it is to make sure that women, girls, and people of diverse OGSE are at the center of the decision making, of the planning, the preparations, policy making that is happening in this space. Thank you very much for your remarks. And now we've come to nearly the end of our webinar. We have one more thing to do, which is to take a group photo, well, a virtual group photo. And now we call on everyone who is comfortable with turning on your videos to turn on your videos. Jit will be taking the photo, and I will do my best to coordinate this. Well, so if you are able to turn on your videos, please do so now. Hello, everyone. It's good to see you.
Hi, everyone. All right. Just waiting for more people to turn on their videos. Right, perfect. We'll have about 3 takes, so please hold your smile. So because we have a couple of pages on Zoom. All right, I'll start now. 1, 2, smile. All right, please hold that smile. 1, 2, smile. Last. 1, 2, smile. Perfect. Thank you so much.
Thank you, everyone who joined us for the webinar. And thank you to our speakers for spending the time with us and sharing your thoughts.
I think Natasha is
Frozen.
Yeah. Thank you so much, everyone. Nice.
Also, last but not least, thank you to everyone who's been working behind the scenes.
Go ahead, Nat.
Just thank you, everyone. Thank you, everyone, on screen and behind the scenes. Take care.
Goodbye. Thank you. Thank you, Natasha.
Okay,
thank you, everyone.
thank you. Thank you, everyone.
Thank you so much. Bye.
Thank you for joining.
And
looking forward to the next one and hearing updates.
Yes,
yes, definitely.
Kumoko, thank you so much. See you.
Thank you, Ramon. Thank you, Jit.
Thank you, Dr.
Bye.
Siobhan. Thank you, Ben.
Boy, thank you, Ben.
Thank you, Siobhan. Thank you, Ben.
Ben.
Thank you, Dr. Sufon. They want to meet you. Dr. Sufon is our executive director in Lao. So,
hi, Dr.
Are you
Sufon.
there? Are you still there, Dr. Sufon? Oh, I think it's already.